So this exercise is for trying to work on external rotation of the shoulder. So what I often see with post-rotator cuff surgeries or chronic pain problems is the patient will compensate with this shoulder shrug to elevate their arm, but what they're not getting is that ball and socket joint motion here. So there'll be this tendency for the body to want to hold maybe the slight internal rotation position. So getting that vertical forearm is one of the primary things we want to get in order to get back to this position behind our head. So one thing you can do when you have a door jamb that you may frequently pass through, let's say the master bathroom or something of that nature, putting a little sticky note or something on that door and having a face towel nearby. So a bathroom is a good place to get all these particular tools. I want to get that forearm, so if somebody can raise their arm forward, even if it's like this, you want to get that forearm against the door jamb, like so. What you'll see though, if somebody's tight like this, is we want to get this motion. So you're going to start walking through the door, you're going to put your forearm right against the door jamb, and then you're going to walk your body so that your feet and toes and everything are facing that mid part of the door jamb. Now if my elbow is floating off to the side, I can use a towel around that arm. And my first goal is to be able to pull that forearm flush against the door jamb. So I may hold that for up to 10 seconds or so, but better is to take a nice deep breath, as much air as I can get in, hold it at the top until you feel like you have to exhale, and release, and do 3 deep breaths like that. That'll be about 30 seconds or more of stretching for that arm. Over time, if you can do this without a towel and get here nice and easy, then eventually we'll progress to turning our bodies away from that door jamb as if we're going to leave, and that will slowly work our way here. Remember to be very careful about how hard you do this activity because you don't want to cause lingering pain. For example, when I pull my finger back, I feel this, it's uncomfortable, but now it's going away. So after this particular activity, you want to make sure that you get that stretch. It may be uncomfortable, and when you let go, within about 20 or 30 seconds, you're back to status quo. No worse, that is. If it is a little worse, grab an ice pack, put that on for about 10 minutes, mentally do this, and then try again tomorrow if it feels okay with a little bit less intensity. So try that anytime you go through the door jamb. So usually, if it's a master bathroom, you might visit that 4 to 5 times a day or more. That's a good opportunity to intermittently get this motion back. Once you get this vertical motion, you can slowly get it to a 90-degree angle here over time. Once this is able to be engaged, like so, then there's that turning of the body from the door jamb, let's say here, away with my little baby steps over time, using that deep breath technique whenever you're at a barrier. So you may start here, get the barrier, deep breath, 3 rounds, exhale, drop and go and do your activity. Next time you come back over time, you'll slowly get to this position, and then ideally that's what that functional position of getting back here is, rather than this compensatory version. Okay?